and I'd like to talk to you about, well, first of all, let me say, I am one of you, right? Health communication has been my profession for the past 40 years. It has been the greatest profession I could have ever chosen. I'm still as eager to do it as I was 40 years ago when I first started doing it. For the past 15 years, I've been doing nothing other than trying to figure out how do we communicate more effectively about the profound public health relevance of global climate change. And the good news that I've come to share with all of you is that you guys, that we together, we are the secret sauce. We are the ones who are going to turn this situation around. And the rest of the world, that the climate science community, all of those other voices who are actively trying to help the public understand climate change, they're important, but we are the ones who have a truly necessary and unique role to play here, because we have the power of trusted health voices, and we have some simple, clear, powerful messages that will help engage the public and help Americans and human civilization rise to this challenge that we face. Let me start by sharing a little bit of data with you in the form of some pictures, if you will. My colleagues and I have been surveying the public every 6 months since 2008. About climate change. It's a polling project that we call the Climate Change in the American Mind project. Before we ask our respondents any other questions about global warming, we ask them this question: what's the first thing that comes to mind when you hear the words global warming? And I'd love to handle this a little more interactively, but since I can neither hear you or see you, I'll tell you what they tell us. This is over 40,000 people that we've surveyed over the past 15 years now. And the most common answer we get in response to that question is essentially polar bears. We hear about plants, penguins, and polar bears. In other words, people think of global warming as an environmental issue, top of mind. The second most common response we get to that question is people talk about science. Often in abstract terms. Sometimes they make concrete references, like to the Keeling curve, the CO2 concentrations on the top of the mountain in Hawaii. But these are abstractions based upon science that people don't necessarily understand very well and isn't necessarily very engaging to them. The third most common reference we get to that, or response we get to that question, is politicians, specific names of politicians, or sometimes parties like the Republican Party or Democrats. And what we've learned, however, is when people name politicians or parties, they are usually pointing a finger at the other party, the other guy's politicians that they don't themselves like. So the top of mind association of global warming with politicians that we don't like is not very helpful. A reference that we have seen with increasingly frequency over the past 5 years or so are references to extreme weather. In my opinion, that's moving us in the right direction. It means that an increasing number of Americans are starting to see climate change top of mind as an extreme or dangerous weather problem. But what we have never heard in the 40,000 or so people that we've interviewed, we have never heard reference to human health, to our children's health, to our own health, to the health of our loved ones or people in our community. This is our opportunity. Right now, climate change as a human issue, a human health issue, is not top of mind for people. But our research shows, as I'll tell you in a minute, our research shows that when people do understand climate change as a threat to the health and well-being of their loved ones, and when they understand climate solutions as an opportunity to actually improve the health of their family and their loved ones, it's an absolute game changer in terms of increasing public engagement in the issue. In the 40 years that I've focused as a public health professional on the role of communication, I feel like the one thing I have learned with greatest confidence is that every public health communication campaign in human history that has ever succeeded has succeeded on the basis of this formula. It had simple, clear messages. Those messages were repeated often. And those messages were brought to members of our target audience by a variety of trusted and caring voices. On the bottom left of this slide is a reference to a paper that just appeared open access this week in the annual review of Earth and Planetary Sciences. It's a paper in which we essentially make the case that this is the evidence-based formula for effective communication campaigns, effective public health communication campaigns, as well as effective climate communication campaigns. So if you want more details about why I'm convinced that this is the formula for effective communication, I encourage you to download that paper. We have used this survey data from those climate change in the American Mind surveys that I mentioned ago, those 40,000 data points that we've collected over the past 15 years. We've used them to identify the key beliefs, or I like to call them the key facts, that are strongest predictors of the Americans who are most engaged in the issue of climate change. And by engaged, I mean at two different levels. Engaged in terms of supporting policy responses, public policy responses to deal with the problem. So that's one facet. And the other facet is engagement in personal actions to encourage appropriate policy responses. Things like calling their elected officials to encourage them to enact climate solutions. The 6 key facts about global warming can be expressed in 12 simple words. I want you to think about these 12 simple words as 6 key, simple, clear messages, okay? The first of those simple, clear messages is that it's real. Global warming is happening. There's no debate about that. The second is that it is human caused, that climate change currently, the change in our current climate is as a result of human activity is what they say, but that really means burning fossil fuels and burning down the world's forests. So human activity is the main cause. Global warming, it's us. The third key fact is that experts agree. No matter what you've heard on Fox News or elsewhere, there really is no disagreement about from the world's climate scientists about the reality of human-caused climate change. The number on this slide that saying more than 97% of the world's climate experts are convinced, based on data, not based on personal beliefs, that human activity is warming the planet. That is an extremely conservative estimate. The truth is, if you actually looked at the peer-reviewed science, it's more like 99.99% of the peer-reviewed studies in recent history have all concluded that human-caused climate change is a reality. Which takes us to the fourth key fact, which is that it's bad. Global warming isn't just bad for plants, penguins, and polar bears, but it's bad for people too. And the thing that unites all of us, that our opportunity to help the public understand the ways in which global warming is bad, is that it's bad for our health. Climate change is harming our health in 8 distinct types of ways. And I'll introduce you to those specifics in a moment. But the broader point here, the simple, clear message here, is that global warming is bad for human health. The fifth key fact is that there's hope, that there are actions that we can take that will make a big difference in responding to this problem. We may not be able to solve this problem quickly, but we certainly can address it immediately, and the actions that we can take to address it will make a world of difference. I used to say there was five key facts, and I ended it up at there's hope, but our research lately has focused on the importance of social norms and the fact that most Americans, 7 out of 10 Americans, give or take, are worried about global warming. But most of those people think they're in a very small minority. They have the impression that the vast majority of Americans aren't in the least bit concerned about global warming. And we've learned that those people who understand that not only are they worried, but they are in the majority, those are the people who are much more likely to be taking action. So think of these as 6 simple, clear messages. All of them are factually true. There are ways to deliver these messages with greater and lesser depth, but these really are the 6 key facts that when we can succeed in communicating them, they make a big difference in cultivating public readiness to bring about societal solutions to climate change. Which takes me to the second component of that formula: simple, clear messages repeated often. We all know that when we run public health communication campaigns, we struggle to get adequate message repetition, adequate reach and frequency. This is some data from some friends of mine at Potential Energy, which is a 501c3 focused on improving climate change communication. And they test their messaging. Specifically, they test how frequently their messaging must be delivered in order to achieve their communication outcome, their communication objective, excuse me. And I just want to read these words on the slide to you because it's really powerful what they've concluded from their research. Based on the data, our best guess is that the average person needs to see and hear about climate at least 80 times a month, potentially even more, to become an active supporter of significant climate action. 80 times per month. That's give or take about 2.5 times per day. On one hand, that seems almost ludicrous. Like, how in the world are we ever going to develop public health campaigns addressing climate change and get 80 exposures per month? On the other hand, I want you to keep in mind that there are plenty of issues in the news cycle today that people are hearing about more than 2.5 times per day. So climate change should be in the news cycle. Climate change should be in the news at least 2.5 times a day. So while this 80 times a month seems preposterously large, it is achievable. And if we are working together, we can certainly move us towards that goal. And then finally is the element of the trusted and caring voices. And my friends, that is us. I know that we have just survived 3 years of a global COVID pandemic, and it does not feel like we are particularly trusted or seen as particularly caring, but the data suggests otherwise. This happens to be Ipsos global data, so this is worldwide. Doctors are the most trusted. If they had asked about nurses, nurses would actually be even slightly more trusted than doctors. Health professionals are the most trusted category of professionals worldwide, and has been so for a long time. Now let me show you US data from our Climate Change in the American Mind project. This was data we collected a year ago, April 2022. We asked people, how much do you trust or distrust the following as a source of information about global warming? I've broken out the data for you based on all voters on the left-hand column, all the way through to conservative Republicans on the right-hand column. First, let's look at the left-hand column, all registered voters. We see that NASA is the most trusted. That makes a lot of sense. NASA does a ton of climate science, and they're possibly one of the strongest American brands, highly trusted. Friends and family are the second most trusted. That also makes sense for all of the reasons you understand, because familiarity breeds liking and trust. And so we trust what our friends and family have to say, even if they don't know anything about that topic. Climate scientists are highly trusted. That's really good. But let's look at number 4, people's primary care doctor, right up there next to climate scientists in terms of being a trusted voice to provide information about global warming. A little bit lower down, we also ask about the American Medical Association, so more of an abstraction. Doctors in general, relatively trusted. In the past, we've asked about CDC, relatively well trusted. In the past, we've also asked about people's local health departments as a source. Relatively well trusted, but less so than CDC, largely because people don't know what their local health department does. But now let's look at the other side of the slide. Conservative Republicans, who are the one group of Americans who are furthest behind on accepting the scientific realities of climate change, who are furthest behind on accepting what I previously called the 6 key truths. Least likely to accept that it's real, that it's us, that experts agree, that it's harmful, that there are actions we can take, and that other people care. And now look at look at the trust they place in their primary care doctor and in the AMA. It's in part because they trust everybody less. They just trust any source less about information about global warming because they are less convinced that global warming is real or human caused or serious. But the very fact that they tell us they trust their healthcare providers or health officials in general, they trust them relatively more than almost anyone else, more than climate scientists, more than leaders in the US military. That is something that belies a real opportunity that we health professionals have to help our conservative brothers and sisters around the country better understand the reality of climate change, not as a plants, penguins, and polar bears issue, but as a human health issue. So climate change harms health through 8 distinct pathways. I'm not going to go into the details because frankly, we just don't have time to go into all of the incredible detail. But if you look at the most recent National Climate Assessment, there's a wonderful chapter on human health, and it goes into these 8 distinct pathways by which climate change harms health. They are air pollution. So obviously the root cause of climate change, the primary root cause, burning fossil fuels, is the primary cause of air pollution, but also hot weather makes air pollution worse. It essentially, as we bake all of the chemicals that are produced by burning fossil fuels, it becomes a denser and more problematic air pollution. So air pollution is the first pathway. Extreme heat waves is the second pathway. Extreme weather, dangerous, violent storms like hurricanes and other forms of extreme weather cause lots of morbidity and mortality. Climate change also exacerbates vector-borne illnesses, waterborne illnesses, and foodborne illnesses, in the sense that these vector-borne illnesses are essentially moving into new ecological niches as a result of destabilizing the climate. Waterborne illness becomes more common because of heavy downpours, among other things, actually tends to wash all of the contaminants, biological as well as in other forms, into the water systems where people will be more likely to drink them. And foodborne illness is the same. Heavy downpours tends to take biological pathogens, spread them into our fields where we grow our foods, contaminating them at the field, the source of the growing and harvesting, as well as then warmer weather tends to cultivate those infections while the food is being processed and sent to the marketplace before it's consumed. The 7th pathway is through hunger and malnutrition. Extreme weather damages our food supplies, makes our food supplies less reliable as well as less nutritious, which has obvious health implications. And then finally are the mental health harms of climate change. Both the direct mental health harms, people who might develop PTSD as a result of having been in an extreme weather event or having had their home damaged or destroyed and therefore being displaced from their home as a result of an extreme weather event, or simply the more pernicious form of mental health harm, just the worry, the anxiety, the depression that many people feel as a result of being concerned that we're destabilizing the very climate that underpins human health and well-being. We've actually taken, my colleagues and I do communication research around each of those 8 pathways to identify how best to explain them to members of the public. So we've essentially prepared very brief statements, and by brief I mean about 150 words, that explain each of those different pathways by which by which climate change harms human health. We explain also who is most likely to be harmed by each of those different types of pathways. It tends to be young children, pregnant women, older people, people with pre-existing chronic disease, people who earn their livelihoods outdoors, and people who live in low-income and communities of color. These are the people who are being hurt first and worst, whose health is being harmed first and worst as a result of climate change in our communities. And what we've learned by testing these 8 short essays, a total of about 1,200 words, is we've learned that reading this material, simple words on paper, increases people's cognitive and affective engagement with the issue. In other words, it makes them feel the issue is more personally relevant, and it makes them feel more worried about the issue. And true to the survey data that I showed you a moment ago, this is especially so for people in the middle of the political continuum and people who are on the sort of on the moderate conservative side of the political continuum. And that is really helpful, because that suggests that the climate and health narrative helps to bring America together in terms of a more common understanding of an issue that otherwise is highly politically polarized. So that's sort of half the equation, how climate change is harming our health. The other important half of the narrative is that climate solutions are also health solutions. In fact, for all of you who've been in public health for a while, you've probably been working on promoting many of these solutions for a whole variety of other important public health reasons. But these five, what I call these five policy solution pathways, all the progress that we make in moving down these five policy pathways, they're not only good for the climate, they're also good for the health and well-being of people in the communities that move down these pathways. So what are those pathways? Well, the first one is essentially stopping burning of fossil fuels, which are dirty, which tend to pollute our air and our water, and instead swapping them out for clean, renewable energy. And to the extent possible, also reducing energy waste, because simply reducing energy waste means we do burn less fossil fuels. So that is a policy pathway that has a profound impact for human health as well as for our climate. The second policy pathway has to do with climate smart foods, farms and food systems. The more we encourage and enable our food system to evolve in a direction that allows people to eat lower on what we used to call the food guide pyramid, more plant-based diets than animal-based diets. That's good for their health, as we all know. It's also really good for the climate, because growing animals to feed them to people is a very energy-intensive proposition. So the more we make progress there, the more we benefit both planetary health and human health. The third policy pathway has to do with clean and active transportation options. The very same things that we've been promoting for public health reasons for a very long time, because the human health benefits are so obvious and profound, they also offer planetary health benefits. Same thing can be said for improvements in our buildings and our homes. The more that we weatherize and make our homes energy efficient and keeping the air pollution out and making sure that we're not producing indoor pollution, the better that is for planetary health as well as for human health. And then finally, the final policy pathway has to do with improved community environments. Environments where we build green space, where we build space for humans to live and socialize, as opposed to devoting most of that space to automobiles, most of which run by burning fossil fuels, and make it very unsafe for pedestrians and others to be out enjoying the roadways, the community environments. All five of those are important, promising policy pathways that benefit planetary health and benefit human health. The importance of talking about them for their human health benefits is that the human health benefits accrue almost immediately as we make changes to move down these five policy pathways. And they accrue locally in the communities that take these actions. Conversely, when we talk about these things for their planetary health benefits, their climate benefits, people become suspect of them because they understand that it will take years for those benefits to accrue, and that if we are the ones, if we take these actions in our community, we're helping our community a little bit, but we're helping all communities a little bit. So talking about the human health benefits of these policy pathways is a way to sort of get around that behavioral economic conundrum that people, including and perhaps especially policymakers, don't like to make investments in policies that don't produce dividends for a long time or don't produce dividends primarily for the people who are making the investments. In our messaging research, we've shown that the ideal climate and health narrative has three parts. The first part is showing the health impacts. We know, for example, that showing the health impacts of air pollution, foodborne diseases, and extreme weather, those are the health impacts that generate the most concern among members of the US population at large. So it helps to show the health impacts because people don't know about them. It helps to identify the policy solutions, the very things I just talked about. People are particularly keen in supporting clean energy and improved community design. And then finally, it helps to affirm a helpful social norm. The point I made previously, people don't know that they are in the majority and of Americans who want to see climate action. So by affirming that, we actually know we increase the likelihood that people will take a variety of helpful actions. The action that we focus on most closely in our research is taking action to contact their elected representatives to encourage them to take action on climate change. And the bottom line on this slide is perhaps the most important, and that is that this optimal climate health narrative with showing the health impacts, identifying the policy solutions, and affirming a helpful social norm, it works especially well with conservatives. The last element of the climate and health narrative that we have only recently started understanding, we actually haven't yet published this study, but it's under peer review at the moment. I will stand by the findings. I'm quite confident they will be robust. But when you tell people about these incredible actions that we as a community can take, and you tell them about the incredible health benefits, as well as the human health, as well as the planetary health benefits, people might question, well, if this is all so good, why haven't we done it yet? And the answer to that question is pretty simple. We haven't taken these actions yet because we have a very powerful set of opponents. Those opponents essentially are best embodied by the CEOs of fossil fuel companies and their lobbyists, and by some politicians who are in the back pockets of those fossil fuel CEOs and their lobbyists. And so we have tested the climate and health narrative that I talked about previously, the impacts, the benefits of solutions, and the social norms. We've tested it with and without calling out fossil fuel CEOs, their lobbyists, and the politicians who are in their back pockets. And what we've learned is that by specifically calling these people out, not by first and last name, but by the role they play in our society in opposing climate solutions, we know that it significantly strengthens people's policy support for climate action. It significantly strengthens their intention to advocate for those solutions. And again, it's most effective with Republicans and independents, all of which suggests that the trusted and caring voices of the health community, we have a whole lot of potential to bring sort of middle of the road Americans and conservative Americans along with us to become unified in the understanding of and the support for climate actions societal level climate actions that will make an important difference. So this is why we have a unique role, because our narrative makes the problem personal to members of the audience in ways that no other narrative that we have tested does. Our narrative brings the benefits of climate solutions into the present in the form of health benefits and into our communities. So it skirts around the problem of feeling like no action is worth taking unless it's taken worldwide, because in fact, the human health benefits accrue in our community if we take those actions. And finally, our narrative is important because we, and perhaps uniquely we, have the opportunity to depolarize this issue, to, if you will, extract it from the culture wars where liberals and conservatives just use it as a point of contention. And we have the opportunity now to get liberals and conservatives and people in the middle to actually be talking about this as a human health problem and talking about solutions as a human health opportunity. So I want to close with two last points. We have all spent the last 20 or so years reorienting our thinking in public health away from individual determinants of health and towards social determinants of health. And we were smart, we were wise to do that because over the past 20 years, we've learned that the social determinants of health are more powerful and they are fundamental to the individual determinants of health. We can't expect people to engage in healthy behavior if in fact we are allowing them to continue to live in unhealthy social environments. So we in public health have refocused our efforts on making sure we're doing everything in our capacity to ensure that the social determinants of health are robust. But I'm asking you today to think about an even more fundamental determinant of health, and that is the ecological determinants of health. When we destabilize our climate, we have the destabilized climate has a direct harmful impacts on all of the social determinants of health, on our health system readiness, and all of the direct impacts on health that I briefed you on earlier, those 8 distinct ways in which climate change harms health. So this is our lane. And if we do not turn our attention to stabilizing the ecological determinants of health, we will always be losing ground in terms of the work that we're doing to stabilize and enhance the social determinants of health, as well as health behaviors and ultimately population health. So my conclusion, this is the way that I have learned to think over the past 15 years that I've been doing this work. And this is the simple, clear message I tell myself because it helps me focus my work. And that simple, clear message is that our climate and our health have a common enemy. And that common enemy is fossil fuels. And the faster that we can revoke the social license of the fossil fuel industry, who is doing everything possible to continue extracting, processing, and burning fossil fuels, we will continue to lose ground in terms of our fundamental job of protecting the public's health and well-being. So today, I invite you to join me. One of the programs in my center, the Center for Climate Change Communication at George Mason, is a program we call the Medical Society on Climate and Health. We maintain a database of concerned health professionals around the country. We use that database to alert people when there are advocacy opportunities that we think that their trusted, caring voices can make a difference. And so I invite you to turn your camera on this QR code. It will take you to essentially a 2-question survey, your name and your email address and where you live, and we will use that information to alert you to when there are climate and health advocacy opportunities where you can use the climate and health narrative that I have shared with you today. So I encourage you to use your trusted and caring voice to help make fossil fuels history. So thank you. I hope you will have some questions for me. I hope I will be able to hear those questions. If not, maybe Mike can put them in the chat box for me to see.
Hi, can you speak a little bit to how sort of depolarizing messages won't get drowned out by the more polarizing messages on either end of the political spectrum?
Well, they will, unless we up the message frequency to an adequate level. I mean, the reality is, if you are a Fox News viewer, you are hearing those messages. An hour of Fox News is guaranteed to get at least 2 messages sort of consistent with the fact that climate change is a hoax, or that's sort of antiquated now. You don't hear that so much, but Fox News viewers will absolutely hear that, the things that those liberal politicians are suggesting to deal with climate change, those would be much worse than any possible harm from climate change. And that simply isn't true. So, you know, I don't like it, but the reality is the climate opposition messages are simple and clear. They are being repeated frequency, and they are being repeated by voices that people on the right see as trusted and caring. Um, so it's incredibly important. While they have a bigger microphone and a better platform than we have, it's incredibly important that we use whatever platform we're able to create to make sure that we are sharing with members of the public what we as health professionals actually know about the realities, the 6 key truths about climate change as a human health issue. And, you know, at best, we're going to start to depolarize the issue. I don't think we're ever going to get the other side to change their narrative until their audience starts to see things our way and realize that being fed misinformation and lies is not actually serving their needs. So eventually we will win, but I'm asking you to use your trusted and caring voices to help us win faster, because we really do need to win faster. And Larry, my dear friend, old friend Larry Bai has asked, would a tobacco-style anti-fossil fuel business campaign be helpful? Larry, I think it would be enormously helpful. I had the privilege of working on the Truth campaign. First, we launched it in Florida in the late 1990s, and then launched it nationwide in the early aughts. And the Truth campaign was incredibly effective in turning around the youth smoking epidemic. And I think we have the same potential to go up against the fossil fuel industry. They learned their deceptive ways from the tobacco industry. We can use those very same communication strategies, but Larry then followed up with the following question: can we also somehow get public funding for it? Yeah, thus far I haven't figured out how to do that, but perhaps you and others in the room can think of a way whereby we could get funding to run a truth-style campaign against fossil fuels. And it's not the people, it's not the industry, it's the product. We need to delegitimize the continued use of a product that in the 20th century was very helpful, but in the 21st century is entirely unnecessary and toxic.
Thank you. I don't know if this is on, if folks can hear me. Thank you. All right, a round of applause, please. Thank you so much. That was excellent. I think that's the last question that we can take. I'm pretty jazzed and energized and motivated, and I'm also going to say I'm going to take a page out of your book for the future for having like my own QR code on the screen for my center and having folks be able to come and talk about that. So thank you so much. Thank you so much.
My pleasure. Thank you all.